All right, maybe the third time is the charm. Most Americans have already been vaccinated at least one time. Most of the measures that are out there require two shots, say Johnson & Johnson's. But there's a push right now just to make sure vulnerable parts of the population are protected to get a third booster shot. This would be earmarked for those who are maybe immunocompromised or elderly or both. Jonathan Seri, following these latest guidelines and how soon we could see them take effect. Jonathan.
Hi there, Neil. Well, while the vast majority of severe cases, the hospitalizations, are mostly in the unvaccinated, there are enough breakthrough infections in fully vaccinated individuals that the idea of administering a booster shot, a third dose, is gaining support within the public health community. A source familiar with the discussions tells Fox News the booster would likely be administered 8 months after you get your second dose. The third dose for healthy individuals could begin as early as mid-September, but is awaiting approval from the FDA, which has already authorized booster shots for persons with severely compromised immune systems. The current discussions involve giving fully vaccinated individuals a third dose of either the Pfizer or Moderna two-dose vaccines.
The additional dose, that booster dose, actually wakes up the immune system, gets it revved up again. It produces a lot of antibodies, and that correlates with our protection and the duration of the protection that we will have.
So, Neil, Pfizer and Moderna were the first vaccines to be approved for use in the U.S., so they would be the first to be authorized if the FDA chooses to do so for that third dose. However, research is also underway to determine the benefits of boosters of those receiving the single dose Johnson & Johnson vaccine. In other words, there could potentially be a second dose of the J&J vaccine as a booster. Now, once the FDA approves boosters for healthy individuals, public health experts say it's likely that you'll see these third doses initially phased in for high-risk groups, sort of like we saw earlier in the year when the first COVID shots were coming out, targeting the highest-risk individuals, such as the elderly, nursing home residents, or people working in healthcare settings. Neil?
Looks like the train is in motion, though. Jonathan Seri in Atlanta. Thank you, Jonathan. I appreciate that. To Dr. Bankole Johnson, IDL Pharma Chief Medical Officer. Doctor, very good to have you. Thank you for taking the time. Who needs these booster shots?
Thank you for having me on your show.
So who needs the booster shots? Who do you think needs them?
The booster shots are very important for people who are, one, immunocompromised, which means that they may be having treatments for other diseases like cancers. It is important for individuals who have immune compromise due to other reasons. And it is also important for people who may be receiving other immunosuppressive drugs like steroids. I think that in general, healthy people are going to have a third vaccine, even if they've had a second vaccine, because it's unlikely that the second shot will protect forever. So the Delta variant is creating greater problems for us than we had anticipated, and there's a possibility of additional mutations. So it's very important that that third shot be administered.
You know, that Delta variant, to your point, doctor, is causing a devil of a time for those around the country, even those who have already been vaccinated, getting COVID again. Now, usually those are very mild cases, but it is a worry. And I'm just wondering, do vaccines lose their potency as time goes on, especially with a variant like this that keeps morphing and changing?
I think you're perfectly correct. Yes, they do lose their potency. And as you know, for example, the common vaccines that we get, like the flu vaccine, has to be administered annually. Some vaccines have to be administered even more frequently than that. You know, my concern is that we're now getting into really a perfect storm of health problems due to people who are unvaccinated, rising COVID cases in places like Florida, but also a second pandemic, which is to do with the rise of people not being able to go to work, because of alcohol use problems, addiction problems, mood disorders, increasing problems at home, processing disorders in kids who have not been attended to during the pandemic, a host or a plethora of really serious health problems. So I think we're not heading in the right direction at the current time.
Yeah, and that's weighing on folks, to put it mildly. Dr. Bankole Johnson, thank you, sir, very, very much for taking the time here. Total cases in cases of the past 28 days that have shot up on both counts. We're keeping track of that for you.